Hi, good afternoon, everyone. My name is L.Vargas, and my project is titled The Women Involved Network Win for Kansas Community Collaboration to Create Health Equity. I am working with co-investigators Dr. Nikki Keene-Woods, Ms. Melody McCrae-Miller, and Dr. Amy Chesser. A bit of background for this project. This is a PCORI Community Engagement Grant-funded project. We're identifying and exploring the health challenges that women face in the state of Kansas, particularly rural areas and underrepresented women. And the purpose of that exploration is to create a network of peer and community trusted providers that can serve these underrepresented groups to overcome the impediments to care that they face. The project is multi-phase, and we've completed phase 1 with the creation of the board of directors, phase 2 with the identification of the major health disparities in the state, and we're currently in phase 3, which is creating the network group. The development of the project is going to span over a couple of years, and in that time, we'll focus on phase 4, which is breaking down the community and institutional silos with the creation of the network, and phase 5, which is developing training and educational plans for providers to reduce the disparities experienced by vulnerable populations. The methodology of phase 1 involved the co-investigators reaching out to a variety of providers and organizations, asking if they were interested in being members of the board. The goal was to aggregate a group of people who are either members of or providers to underrepresented groups of women. We're fortunate that we have members from academia, the social services realm, and community stakeholders, just to name a few of their affiliations. Once the board of directors was appointed, we had our first quarterly meeting. After that quarterly meeting, we invited members to take part in a Qualtrics survey. And the survey was both quantitative in that we gathered demographic information from the participants to determine which groups were represented among the board members. It was also qualitative as we asked open-ended questions to help identify the major health concerns that we would tackle when the network formation began. After the Qualtrics survey, we conducted some open forum discussion to get network membership recommendations. So that was organizations and providers who are going to serve the target populations that we're looking to help. The results from the Qualtrics survey determined that we had 9 out of 13 board members participate. The majority were female, age 45 to 54. And they all had post-secondary degrees and were employed full-time. After we gathered the qualitative data to identify the health disparities, and I did conduct a thematic analysis of the board reported health concerns. And we chose to focus on 3 umbrella categories, which are reproductive health, health literacy and access to education, and mental health. And for example, if someone said that depression was an issue for a certain age group, that went under the umbrella of mental health, right to choose, that went under reproductive health, and so on. Based on the board recommendations, the results of our open forum, we have made over 60 network alliances to date. From the results, the future focus of the project really needs to look at variation in the representation among the board members. This spans across all of these categories that I have listed here. Age, we definitely need representation of people over the age of 65. Their health concerns and needs are going to vary from people that are in different younger age groups. Varied employment status, because people that are employed part-time, in retirement, or unemployed are going to have different healthcare coverage than someone who has full-time employment. Some may not even have any healthcare coverage at all, which of course is going to affect their healthcare access. Education levels need to be representative of people who have education that's probably less than post-secondary degrees. The reason we're looking at that is people that have varying levels of education are going to also probably have varying understanding when it comes to their health literacy. For racial and cultural diversity, we actually did not ask for participants to disclose that information on the initial survey, but we obviously understand the significance and health disparities that minority women face in comparison to non-minority women, and that's really important for us to focus on, particularly when it comes to health outcomes. And then finally, LGBTQ plus representation needs to be established as individuals identifying within that spectrum. They're also going to experience different impediments to their healthcare needs. And we want to make sure that there's representation within the board as well to voice those concerns. We are working in a social ecological model of women's health. Right now, the board creation served as the individual level representation. The interpersonal level, we have individuals who are primary care providers and also social service providers. Our organizational reach is covered through the network creation, with community and professional organizations being part of that network. And in the future, we hope to have community effects as more patients and members of the community reach out and partake in the services of the network providers. Finally, with all of these efforts, we hope that it'll serve to affect policy change and healthcare access for women throughout the state of Kansas. And we will always have an open call to action. So if anyone has any resources for community engagement within the spectrum of need that we've identified with reproductive health, health literacy, and access to education or mental health, please feel free to reach out to me. My email address is there at the bottom, L.Vargas@shockers.wichita.edu. And here are my references, and I am open to any questions. The motivation behind the project was I'm working with principal investigators that have a focus in public health, and we understand that there's a lot of health disparities when we look at rural areas or groups of underrepresented women, whether that be socioeconomic, racial, any of those groups that don't receive what would be considered appropriate health care for their needs. And so we wanted to focus a study on figuring out what the issues were, the major issues that women faced in these groups, and find network, create a network of providers that can address those issues. So we're basically trying to create a bridge between the different organizations and providers that are in the city of Wichita and then across the state, and the people that need their help, and to bring them together. We want to break down kind of those silos of individual access that people may have with certain organizations, but not this organization, and just kind of make it an open pool for people to receive the care that they need. I'd probably say if given, any amount of funding, it would definitely go to further developing, probably within the fourth and fifth phase, creating some type of educational tool for providers to use to understand how to better serve those groups of women. So if someone says, I don't feel like when I go to my physician, I'm able to communicate with them in a way that helps me understand what I need for my care, or to explain to them what I need for my care, and maybe creating some type of training material to help bring those two pieces together, so that when a woman has an issue and she goes to her physician and speaks with him or her, they're understanding their concerns, and then they're also giving them information of care that they understand back. So I don't know what that development of training would look like, but funding would help to probably facilitate that, whether it be web-based or or not. So thank you.